health correspondent Nicola here. Nicola, good to see you. Very interesting development, but as we just said, not everyone agrees, and I'm sure it comes as such a shock for people who are caffeine lovers.
Yeah, it's very worrying, I think, for people who are either pregnant or planning to get pregnant. I mean, these women are constantly being given completely contradictory advice. One time you should do this, then you shouldn't do that. But this research, which comes from Reykjavik University, it's Professor Jack James, and he initially started looking at 1,200 different studies and whittled them down to the 37 that you talked about there. And he says basically there's no safe level for caffeine, and that changes should be made with regards to the advice that's given to women planning to get pregnant or who are pregnant. So I spoke to him via email, and he actually said to me that caffeine is, it's a chemical, it's a substance, and it's an addiction to that can cause just as much damage and harm to children, to newborn babies, as any other substance. He talked about babies being born with the withdrawal symptoms that are for caffeine that are similar to withdrawal symptoms born to mothers who are addicted to narcotics. And he said really what you have to take on board is the fact that caffeine can cross the placenta, and it can damage the neural pathways in a baby's brain. It can have effect on their hearts, on their respiratory systems. And he says that's really why pregnant women should just give up caffeine altogether. And as you said there, it's not just the coffee, like our daily morning cups of coffee. It's in tea, it's in chocolate, it's in cola, and it's in a whole variety of drinks. And these are what he's saying are unsafe, and that women shouldn't be doing it, shouldn't be drinking it. They shouldn't be consuming it in any way whatsoever.
I'm sure, Nicola, mothers, new mothers and pregnant women are very worried right now, especially those who have been drinking coffee. But is there consensus? Does everyone agree?
No, they don't actually, and it's quite interesting. There's been quite a lot of reaction to this research that's it's a peer-reviewed study published in the British Medical Journal and the BMJ. But here in the UK, the Royal College of Obstetricians and Gynecologists say that more robust research disagrees with this and says if you have small amounts of caffeine, talking about 2 cups of instant coffee a day, that's absolutely fine. I mean, Professor James himself actually did say that there can be confounding factors. So women perhaps who might not take notice of recommendations of healthy ways to behave during pregnancy, for example, reducing the amounts of coffee and caffeine that you're taking, might also not take notice of other suggestions like don't smoke, don't drink, don't eat certain cheeses. And that might have some implications. And this is something that the Royal College are saying, is the fact that, if you have very small amounts of caffeine, these 2 small cups a day, the risks are very low, the risks are very small, and that probably is still safe. So I don't think women should be too panicked by this research.
Nicola, thank you so much. Nicola Hill, our health correspondent, live in London. Appreciate it.